Kai not here. Kai and Akil. Only two not around. Am I right?
Should be three, right?
Kai is trying to join. So, Akil, okay. Let's get started. And thank you so much for being on time. I really appreciate that. I have to shout to be on time, isn't it? You have to grow up. Okay, anyway. Today we will talk about a subject, we call it, or we can say topic. It's about infertility, but we select infertility in male. Okay, so this is actually not all medical students learn this during preclinical.
Doctor,
Yes.
the voice is not clear.
Only for you or everybody?
Me too. It's too low.
Now? Okay, yes. I speak for a while, then you let me know again, okay? Yes means still not clear or clear now?
Now clear.
Clear, all right. Okay, thank you, Rawan. Okay, so we speak about the infertility, especially in male, and we need to highlight the seminal analysis. Okay, let me go to the slide. This one. Okay, seminal analysis. Okay, so we need to know a little bit about what's infertility in general. Okay, infertility. Okay, what do you think when people try to find if they are fertile or not?
Before they have to give us semen specimen.
When somebody is complaining or trying to seek medical help.
Don't have any children.
Try to get the semen from male.
Yeah, but when somebody start to complain, would you like to complain tomorrow? You go to the clinic and you complain?
When married, get children, but don't get children.
Yes.
Okay.
Yes.
For how long?
When your mom.
2 years.
So okay, let's sorry.
2 years.
When what?
When your mom only talk about children. Mother-in-law.
Okay. Of course. That's from after 1 week, I guess. The first question.
Yes.
Okay, that's something we have to consider. Okay, what else?
When we have checked that the female is normal.
When what?
When we check for there is no problem with the female.
Okay, so you need to check female first, then you check the male.
Yeah,
that's
usually our people mindset.
Yes, mindset like that. Yes.
Yeah, but we have to change the mentality. We have to do something. We don't have to accept. They do that, we don't do that. Okay, you never accept that on yourself. Okay, so now we are not talking about male or female. We are talking about complain, when you complain about infertility. Okay, let me pick up who? Hazila, choose one.
Hazila.
Yeah, choose one of your classmates.
Okay.
Who? Akil.
Akil.
Okay, Akil.
Yes, Doctor.
Akil. Okay, let's say you already finished your professional 2. Okay, not before that, please. After you finish professional 2, 1 month, then you get married.
Amin.
Yes, Doctor.
Okay. So when will you? So you are medical, and let's say your wife is what? Artist. Okay. don't marry from medical. Okay, artist. So when will you advise your wife and you yourself to get medical? Maybe you need to check what's the problem with you. Why you don't have babies not yet. And your mother asking you every single day.
At least I will ask her to do medical checkup for fertility at around like 3 years or something.
And how about you?
Also the same as me, the same as both of us will undergo the.
Okay, when? I want to know when. After 1 month, after 1 week, after 10 years?
I will probably wait around like 2 or 3 years first, and then see if it's how is it, how will it be, and then if like around 3 years we still haven't got.
3 years. Oh, okay. You are very patient. Okay, 3 years. Okay, Shahira, let's hear from Shahira. When? Same question. Okay, just give me after 1 month, after 6 months.
Maybe after 2 years.
Huh?
After 2 years.
You said 2?
Yeah.
2 years. Okay. Nakib?
After 1 year.
Nakib?
Yes, Doctor. After 1 year.
1 year.
Yes.
Okay, I agree with Nakib. Okay, 1 year is just fine enough. Okay, when we say there is infertility, why we can think about infertility, even though if you didn't do medical checkup for this problem? Why we say or we think that there is a problem, there is infertility? Let's hear from Siva.
Doctor?
Yeah, why would you think that there is infertility? Let's say your sister, let's say you have a sister, she get married, then after 1 year, you think as a medical student, now you are not a medical doctor yet, you are a medical student, year 2, and your sister get married 1 year ago or a little bit more, then you think about infertility. Why would you think that this couple, they have infertility?
Okay, maybe about their lifestyle.
I mean, why you think about they have infertility, regardless lifestyle, not the risk factors, huh?
Okay.
Yes, good. That's good point. For as a risk factors.
Okay. Age.
Okay, that's another risk factor. Okay, who can help? Anybody? If you know, you can just help Siva.
Because there's no baby conceived.
Yes, they don't. Your sister didn't conceive yet. Even there is no miscarriage or there is no abortion, no pregnancy at all for 1 year or more. Okay, so now during pandemic, let's say your sister is in KL and the husband in Penang, and with MCO and all of those things, so maybe they meet every 3 months or 4 months. So is this considered to be infertility?
No.
No, isn't it? So we have to consider other things. Okay, so Siva already started very good point that we have risk factors. So we don't speak about male or female, okay? So it's equal for both of them. So risk factors, as Siva already mentioned, we have to think about age. So if your sister, she got married, she's 45 years old, let's say. She was traveling, she was busy with work, doing PhD, this and that. So she has no time for marriage. Then she get married, maybe 45. So do we think about infertility?
Yes.
Yes, because it's very high risk factor, the age, for both, okay, for male and female, the age. So we have the age, we have lifestyle. What do you think, what kind of lifestyle?
Unhealthy.
Social, very social.
Alcohol, smoking.
Alcohol, yes, very good. Alcohol, smoking, very good. What else can affect? Huh?
Changing partners.
Yes, yes. Okay, but not for Muslims, isn't it?
Yeah, no.
Yeah. So in the future, if you work in UK, for example, or you are a student there, so you have to change the way of asking. So also here in Malaysia, you have to ask. So we don't consider everybody's perfect. So you have to ask everything. You have to ask about sexual transmitted disease. You have to ask about alcohol. You have to ask about smoking. You have to ask about what else?
Drug usage.
Yes, yes, very good. This is very, very important point. Drug abuse of using drugs. Okay. What else? Anybody wants to add? So this is we can say risk factors. Risk factors. How about chronic disease? Any chronic disease could be a risk factor.
Diabetes.
Diabetes. Yes, very good. Diabetes is one of the chronic disease which may lead to infertility. Okay, so let's go to the slides. So infertility, so always think about both. Don't blame only on the ladies. Infertility couple, infertility, if considered to have infertility, if they try, so means they don't be apart for 3 months or 6 months. So try regular, but fail to get pregnant within 1 year. Has to be within 1 year. Okay, if less than that, we just tell them go back home, relax, enjoy your life. That's it. So if couples came to you after 3 months of marriage, okay, and they try within those 3 months, so and they come and complain and they are under stress, as you mentioned, maybe because of the families and friends and everybody's asking, blah blah blah. So you just tell them go relax and come after 1 year. Okay, enjoy your life, because stress itself, it's one of the risk factors. So if you want to check every month, am I pregnant or not? Am I pregnant or not? So the stress factor, one of the things which can be, oh, Akil, just wake up by this. Okay, so risk factor is one of the things which can be stress. So we have to enjoy our life, just do our best and don't think about it. Okay, so that's one of the very important. Fertility does not include miscarriage or abortion. So means if you have couples, ladies, so you have to ask them, did you get pregnant before? Did you lose the fetus, or do you have abortion before, or miscarriage? So before 20 weeks, before it miscarriage, after that abortion. So or the pregnancy itself incomplete. So that's we don't say that's a infertility. Okay, that's not infertility. Okay, so we need to find underlying cause why there is miscarriage or there is the pregnancy cannot be completed. So we have to find the underlying cause, and it's not under infertility. It's not under category of infertility. We don't call it infertility. Infertility itself, we call it primary. We can divide it or classify into primary and secondary. Primary means never ever conceive. That's primary, never ever. Okay. Secondary means the lady might have one child or more, or might have experience of miscarriage or abortion, but after that failed to successfully conceive or getting pregnant or having pregnancy itself. So if no pregnancy after miscarriage or already has a child, then after that 1 year or 2 years or 3 years there is no successful pregnancy. So this is, we call it secondary infertility. This is, we call it secondary infertility. Okay. Okay, so risk factors, you already mentioned a risk factor. So for example, age, we have different age group. For a female, it started from age 35, but doesn't mean cannot be pregnant after age of 35, but it's a risk group. For men, after age of 40, means 42, 45. So the chance will be, we can say the chance will be less. So of course, for ladies, the chance will be 0 after menopause. So no more ovulation. There is no pregnancy after that. Okay. So the age group 35 for ladies, for gentlemen around 40 years. Okay. Diabetes, as Akil said, one of the chronic problems which is highly related to infertility, but doesn't mean every diabetic patients won't be able to, for example, ladies diabetic cannot be pregnant. No, but it's a risk factor and high risk group. Okay, eating disorders like anorexia or bulimia, those things can affect on a chance of getting pregnant or conceived. Okay, alcohol use or excessive, we can say excessive drinking alcohol. Smoking as well, we already mentioned before, alcohol smoking. Exposure to toxins. Okay, so maybe somebody's working in a factory or maybe in the lab, already exposed to toxins, so has to be away from that place, working place, until they got pregnant or they have a baby, then they come back to work. So that's why one of the things we need to ask about working place and lifestyle of your patient. It's very important. Okay, exercises is good, but over exercising, especially for ladies, can lead to infertility. Okay, so those like tennis players, ladies, and they have also risk factors. So they over exercise. So maybe every day they exercising maybe for 6 to 8 hours every single day. So that's over exercising. So can lead to infertility. Okay, exposure to radiation, any type of radiation doesn't mean related to cancer. So maybe X-ray or any kind of radiation. So it has to be 3 months after radiation, then you can have chance for getting pregnant, not before that. So radiation, one of the risk factors, but all of those risk factors doesn't mean 100% if excessive alcohol, no pregnancy, if smoking, no pregnancy, but those has high risk group. Sexual transmitted disease also is very important. Smoking, we already mentioned. Alcohol, stress, if your couple under stress, maybe because they are living with the parents and they have problems every single day, or they have any kind of problems, so makes stress, or maybe they have exam, any other situation that making stress. So this is chronic stress. Okay. Substance abuse, already Akil mentioned this also. And another one is very, very important, which is weight problems. Weight problems, not only obesity. Okay, underweight as well. Both obesity and underweight, both are risk factors for infertility. Okay. Okay. So we will those risk factors in both genders. So also you can find more risk factors for female only or male only. For female only, maybe there is problem in the uterus, like there is infection in the endometrium, or there is problem in the ovaries, or any kind of hormonal problem. So we have to know more risk factors, like related to female or male only. Male basically related to scrotum, or hormones, testosterone hormone, or the sperm count, or quality of the sperm. So we have other risk factors, can be for female only or male only, but those risk factors for both. So when you have couple, you have to start. So you have couple married for 1 year, trying to conceive within this 1 year. They have no problem, those risk factors, or they don't have problem, or even if they have, so maybe we still have a hope with them. So if, for example, the husband is excessive smoking, so you need to advise to try to stop smoking, or maybe try to make it as less as possible, or maybe working in a place like he's radiologist, so he has to be away from the place for maybe 6 months, or technically more than that. It's not easy, but you have to do something, and you start working in both. We don't choose only the female, start with female, and if she has no problem, then we check the male. That's not good at all. You have to be fair. You have to start with both of them at the same time. So maybe the problem from one side, maybe no problem, but this couple cannot conceive. Okay. Sometimes the problem unknown. You don't know why. So if she get married from somebody else, she has no problem. If he get married from another lady, has no problem. So maybe both of them, they don't have problem, but somehow they cannot conceive. This happens. So in male, what we do, the most important thing, we need to do seminal analysis. That's a must. We have to do seminal analysis. Then after that, we can go with a blood test, or scrotal ultrasound, or both, or we can do 3 of them. But the one which is a must, we have to start at least, we check seminal analysis. Okay. Okay, any questions so far? Hello?
No question. No,
okay,
doctor.
so we continue. So seminal analysis, we need to ask the man to give us a sample, and we proceed with this sample. This is what we call it, seminal analysis. So we check few things. We will go one by one later. Okay, so in case if we think about infertility, so when we ask for seminal analysis, we ask for seminal analysis in 2 things. If we think about infertility, maybe primary or secondary, and we have something else, we call it vasectomy. So maybe in Malaysia, it's not something usual. Also in Arab countries, it's not usual, but in other countries, it's famous, or it's something normal. They do vasectomy to stop Stop what? Why we do vasectomy?
Stop the travel sperm.
This is one of the things for birth control. For birth control, vasectomy. Vasectomy for birth control. Okay, so usually for us, for maybe for Malaysian and for us like Arabic, usually the ladies start having maybe oral contraceptive tablets monthly, or there are other ways, you know, in pharmacology class. So we have other ways, sometimes the male, but it's not usual. In other countries, sometimes the males doing vasectomy, but once you do vasectomy, after vasectomy, we want to know, is the surgery, is it successful or not? So we have to have sperm analysis, and has to have zero sperms, no sperms at all. So that's for birth control, vasectomy. So we do a semen analysis in two situations. Number one, to check the infertility condition. Number two, after vasectomy. Okay. Okay. So we ask for a sample from the male, and usually we need this sample to start from the time of collecting sample to start the analysis has to be not more than 1 hour. Not more than 1 hour. So usually we ask the patient to do it within the clinic or the hospital, has to give the sample at that place, or is in some situation maybe living around, but it's not good. Maybe the patients walk to the clinic, and because of the temperature and other factors, so the sample will get destroyed before starting analysis. So it has to be 1 hour, maximum 1 hour. Better to be less than 1 hour from time of collection until time of start the analysis, the procedure or the analysis. So once you got the sample, we can check a few things we can see without starting. So the color, we can check the amount, all of those things. Then we have machine to proceed with other stuff. Okay, so what we need to see. Number one, we need to check the sperm count. So of course, you will not calculate. Erase this. So the sperm count has to be more than 20 million per ejaculate. So one sample, you have one sample means one ejaculate, which is has around 20 million or above. So that's good enough. So if less than 20 million, there one sample, one ejaculate. One sample means one ejaculate, not more than one ejaculation. So one ejaculate means one sample. In this sample, usually we have maybe 2 ml, 3 ml, around that. So we say 20 million per milliliter. Sorry, milliliter, not ml. Per milliliter, okay? So 20 million per milliliter. If less than that, we call it oligospermia, means it's less than what we expect, like hemoglobin. Hemoglobin, for example, you find somebody's hemoglobin is 10. So you need to think, is it, of course, male or female, but it's not very low and it's not good enough. So oligospermia, it's less than 20 million per milliliter, but it's not good enough. Okay, we have something we call it azoospermic. Azoospermic means there is no sperms at all, and this one we need it after vasectomy. But if somebody has no vasectomy and has no sperms, so that's considered one of the things which can be the reason of infertility, and those people, unfortunately, usually they don't have hope. If they don't have infection or they don't have other underlying cause, so it's this case is very difficult to handle. Okay. So motility of the sperm. So it has to be when you look under microscope, it has to be moving forward movement. So sperms has to move forward movement, and the movement has to be 60%. 60%. So that's by observation. Okay, so this one to give you this result. So that's why we said we need to start the analysis within 1 hour, not after 1 hour. Because if after 1 hour and you find the motility is 30%, so maybe we will think that, is it because of the time or because of the sample? So that's why we have to start before 1 hour after the collection. Okay. Morphology, or how the sperms looks like. So you can see some the first sperm on the left here, it's normal. The others considered to be abnormal in the shape. So it's okay. We can have some abnormal, but has to be overall 30% or more of the sperms in normal size and shape. The size and shape has to be normal, but not 100%. So it's okay to have some abnormal, but we need 30% or more normal in size and shape. So for successful fertilization later on. Okay. Okay, so if we don't have if we have problem in the size and the shape, as I mentioned, we will have problem in fertilization process later on. Okay, volume. So per ejaculate, it has to be not less than 2 ml per ejaculate. The volume also important. Okay, and also we need to check the fructose level. So we know that the sperm to reach the ovum or to start the process of fertilization, it needs time to travel. So need fructose, need a source, or even the sperm within the male reproductive system still need fructose for energy to stay alive and can has a power to move. So the fructose level has to be around 13 micromole per sample or per ejaculate. Okay. So the source of fructose, it's from seminal vesicles. So if we don't have enough fructose, so we have to check on seminal vesicles as underlying cause the condition. If we have maybe there is infection, so we have to give the patient antibiotics, maybe for 1 week or 2 weeks, depends on the course of that antibiotic. Then the patient has rest. Then we try the second sample. So after course of antibiotics. So if the problem in fructose, so we might think about maybe there is infection in seminal vesicles. So we check if there is seminal vesicle problem or not. We try to give the patient the right treatment. Then we do another sample. So the second sample, if the problem in seminal vesicle infection, for example, so it will be normal fructose level. pH also important for the seminal analysis or seminal fluid itself. It has to be between 7.2 to 7.8. Okay. Okay. So if we have also problem in pH, like it's more acidic, so still we think about seminal vesicle. Maybe you know that the seminal fluid itself, it's combination from the 3 glands with the sperms. So the fluid itself, part of it comes from seminal vesicle. So maybe there is a blockage in the way from seminal vesicles to the urethra. So we don't have enough, or maybe we don't receive the production of seminal vesicles. So that's why it's acidic, and that's affecting on the sperm. Okay, also if we have problem in pH, also we think about infection. Okay. Okay. Liquefaction, it takes around 20 minutes. So means after ejaculation, there will be like the seminal fluid itself. It will be like not fluid. It's semi-fluid or like clotting for a while. Then back to the fluidity, or back to be liquid. So this is we call it liquefaction. It takes around 20 minutes. Like for example, bleeding time. So if you have a small wound, you have a specific time that to stop bleeding automatic. So liquefaction, same thing. Okay, we have 1 minute, but I think maybe I need still 5 to 10 minutes. So we reconnect again. Is it okay for you?
No
Yes,
problem.
Okay,
Yes,
we
sir.
reconnect, only add 5 to maximum 10 minutes, okay? So you
Okay.
have a break for 5 minutes, then I see you later. Okay, you can leave now.
Okay. Thank you.
Rafa, Akil, Azrai, Ayun, Aisha, hello, little child. Hi, hello, Anis, Onet, Otto, Rawan, Ayman and Ahmad. Then we have Aizul. Aizul, are you there? Are you back to sleep? No. Okay. Lila. Kai. Lila, your room today is lighter. I'm sure you feel better. But still your curtains closed. You are using light.
Yes.
Electrical light. You need the sun. Okay.
I'll open it, doctor.
Yes, please. Walk around. Okay. Admit another 3 to be admitted. So who's not there? Maybe I check at the end, okay? Sometimes I forget to write down. Okay. Okay, I think everybody's here. Let's continue, okay? Here, share. Okay, so let's say you have you already done with the seminal analysis, and you have something wrong, like maybe the sperm number is less than 20 million, or the fructose, or the motility, or whatever. You have problem in this sample. So what would you do? Let me ask Aisha. Aisha? Okay. Okay, I repeat for all of you. If this sample, the result of sample has something negative, something abnormal, what will you do?
Correct it.
Sorry? Akil?
Correct. Try to improve your sample.
How?
Depends on the cost.
Okay,
If
now
it's
we
like
don't think
because
about, okay, as a medical doctor, of course, this procedure you decide to do because you have to do, isn't it? So maybe you have couple, 1 year, they don't conceive, so you have to start it. So regardless the cost, you have to do it. Okay, so if this sample come with negative result, what would you do? You will say that to the husband and you tell them, okay, you have an infertility problem and you will never ever get the baby. So you have to live with it. Would you say that, Rawan?
No,
Would you say
maybe
that?
corrected.
Yeah, what do you mean by correct? It's not the right word.
Repeat, doctor.
Repeat, yes, yes. You have to repeat. So if you have problem with this sample, you have to repeat it. Okay, so ask the patients to redo it. Okay, you can tell the patient, depends on the patient's. Actually, you have to speak with your patient. You tell the patient, for example, we find that, for example, one of the criteria is negative, for example, the sperm number or whatever, but we have to confirm, so we have to do it again. So better to do it 3 times. After 3 times, so it's confirmed. You have problem with the fructose level, or you have problem with the number or whatever. So 3 times will be good enough. So it might be false negative. What can make it false negative? Lila, think, Layani, Arafa. 3 of you. Aisha also, I didn't hear from Aisha.
The sample is more than 1 hour, maybe.
Yes, you're clever. You got the point. So maybe you receive the sample after 1 hour. Okay, so sometimes the patient lie. Sometimes the patient doesn't tell you the truth. So don't just trust the patient 100%. You have to think about it. Maybe it's more than 1 hour. So the patient just doesn't want to do it again. So one of the things, so you have to make sure when you repeat it, you have to make sure to have the sample at the clinic and you start the procedure or the analysis maybe after 15 minutes or 30 minutes, something like that. Okay, what else? Layani, Lila, and Akil Azrai. Arafat out.
Contaminated?
Huh?
If contaminated?
Yes, yes. Maybe the cup itself, it's not clean. Yes, there is contamination. Very good, Lila. Good thinking. So the cup itself has to be sterile. Layani, are you reading Al-Fatiha or what?
I can't see anything, doctor, because I didn't sleep last night.
Okay, Azrai. Akil. Okay, who else? Anybody else can think about another reason?
Doctor, what if they use another man's sample?
Oh. I never think about that. But it might be. So you have to have the patient in the clinic, make sure you have the sample from the patient. Sometimes they take by needle aspiration. They take aspiration. It's we can say it's like biopsy, like the way of taking biopsy. Okay, so if you feel your patient is playing around and want to blame the wife, might be. Okay.
Maybe, doctor, maybe when they transport the specimen, so when the specimen arrive at the lab, so it might cause the
handling, the sample handling, yes. Maybe the nurse, or also you said maybe not the patient, maybe the labeling. This is very common. So maybe you have 2 patients. So the nurse, maybe a lot of work, lack of sleeping, very tired, and so on. So maybe it's not the right patient, not because the patient wants to play around, because of the mislabeling, or we can say mishandling. Maybe the machine itself, you need to do troubleshooting of the machine itself. What else? Okay, if your patient, for example, has tonsillitis, and on antibiotic, for example, augmentin. So during the course of antibiotic, this can affect the result of seminal analysis. So has to ask your patient to finish the his course, the antibiotic, doesn't has to stop, finish it. Maybe it's 1 week or 10 days, or maybe usually maximum 2 weeks. Finish, relax 1 week, then come for the sample. So you can take sample again. Maybe you didn't take a proper history or whatever. So after the false positive, false negative, so you need to ask, or you think, what's the problem with this patient? You can think if the patient's on a course of antibiotics. So one of the things, okay? Anything else? How about radiation? So if the patient has a car accident or felt off during exercising or whatever, maybe 1 month ago with the X-ray, so you need to do this sample 3 months after radiation. 3 months, whatever the radiation, the kind of radiation, the cause of radiation, you have to do this type of analysis 3 months after the last radiation. Okay, can be, for example, as simple as that. Maybe X-ray. Sometimes the patients doesn't feel that it's important to tell you that, oh, okay, I had I felt off 1 month ago, and they made X-ray for my head, for example, to make sure I don't have fracture. They don't think that it's important, so you have to ask about that. So we have to make the patients relax for 3 months, then you do the analysis again. Okay, what else? What else? Because I didn't write down, I don't know if I forget any point. Excessive alcohol or smoking. So all of those things has the patient to help to have the right result of your seminal analysis. So you can check also the risk factor, and to help the patient to, or those couples to conceive, or even if you okay, let's say you get married and you are busy, or it's not the right time for you to have children. So maybe you are doing master, or at that time you are traveling, busy with some work like that. So it's not the right time. So once you feel right time, you have to be prepared. So for example, number 1, you need to eat well. You have to watch what do you eat, okay? And also you have to watch your body weight, okay? Okay, you have to stop smoking. And if you, okay, some people drink alcohol, have to also try to stop alcohol, or any kind of drug abuse, they have to stop it. Okay, if they have sexual transmitted disease, they have to treat this condition before or to be prepared to second stage, which is conceived. Limit exposure to toxins or stop exposure to toxins. Sometimes maybe you live your area near to factories, and of course we cannot tell you, okay, move to another city or move to another country. So sometimes we cannot do anything, so we try to limit the exposure. Okay. As we mentioned, exercise is important. You have to continue, but we have to don't do overdo exercise. So this is for athletes, not for us. Okay, I think that's that for today. And this is last class for reproductive system. So next week we will have presentations, each group 15 minutes. Then after that, we have the final module, hemobiotic. For physiology, I'll have with you 2 to 3 hours. Then I have 1 BBL with you. Okay, so for today class, any question?
Can I ask a question, Doctor?
Yes, Leela, please.
About the, it's not about the infertility, but about the sperm shape.
About the?
Sperm shape. the shape of sperm.
Okay. Yes.
They have different kind of shape.
Yes.
So, can the abnormal sperm fertilize the ovum? And if they do,
No. The abnormal shapes doesn't fertilize. Only the normal shape with the normal size. Only those sperms successful to fertilize. The abnormal, we can find abnormal. So let's say you have 10 sperms. 10 sperms, they reach the ovum. 2 of them normal. The other 8 abnormal, maybe shape or size. Those 8, they have 0 chance to fertilize, to penetrate the outer layer and the other layer. Only those 2 with normal size and shape, they reach the ovum. They have a chance to penetrate the 2 layers. Okay? So those with abnormal shape, they have 0 chance to penetrate the outer layer and the inner layer. Okay, Lila, it's a very good question. So means we can find abnormal shape, doesn't matter, but the percentage, it's matter. Okay, the percentage, we need at least 30% normal, so to be able to have chance to fertilize the ovum, because those abnormal, they has no chance to fertilize the ovum. Fertilize means they cannot penetrate the layers. They are unable to penetrate. Okay, Lila, thank you so much. Any other question? I'm not expert in infertility, but I can help whatever I know. Okay. So this is a very big topic. I like it actually. For me, I'm very interesting for this topic. I like it. Okay. Hopefully, maybe 1 or 2 of you will be specialists in this field in the future to help other people. It's very interesting. Or you can do maybe some lab works to find or figure out more about this. Okay. All right. Any other question? No questions? Okay. So that's all for today. Next week, for the presentation, I need 1 leader for each group, okay? So if you already decide, would you please write your group? I'll send for you via WhatsApp. Then you just write your group members, and number 1 is the leader. So, for example, number 1, we have Oyun, number 1. Then number 2, Anis, Hazila, blah, blah, blah. So we have 5 students. So number 1, that means the leader. So number 1, you need to share the slides during the presentation, okay? So you can choose your group member, doesn't matter, but has to be 5, okay? If it's impossible for you because communication or whatever, you just let me know, I can help. You can make it less than 5, but 5 is fair enough. But if you have problem for having 5, you still can change, okay? Each student has to present 2 to 3 minutes. Overall, the presentation, 15 minutes. Okay, so while you are searching for information, so maybe you find, like, for example, one of the things during pregnancy, there is changes in the heart rate. So we put this one under cardiovascular system. Okay, then you find something about, what else? About skin. So we put it in another system. We don't put it under cardiovascular system. Then while you are searching, so you try to compile your information. So you can work as a group in this one. So we decide, for example, Anis will do cardiovascular system. So the group member, if you find something cardiovascular system, you can share with Anis. So if she already has, okay. Anis, if she finds something for endocrine, so she can pass up to the person who's going to present endocrine. Then you need to practice to present within 2 to 3 minutes, not less than 2 minutes. You have to have your side 2 minutes. Okay, this is not including introduction or not including if you want to do summary, it's not included. Okay, so if you have any question about the assignment, you can send in the group. Okay, so everybody know the question, and when I answer, everybody knows. Maybe other people has the same question. Okay, so
Doctor, for the presentation, the leader should present first, or if the leader for the group?
No. You can choose who will present first, but the leader just he's responsible or she is responsible to share the presentation. Okay, so you have one person has the presentation, the whole presentation. I don't want to say, oh, okay, Rawan is not here. We don't have Rawan slides. Like that, okay? So if you are with Oyun, and Oyun is the leader, so Oyun, make sure that you have the slides for everybody, including Rawan, even during the day of presentation, if Rawan is not there, but your presentation is complete because we have mark for the group work. Group work, we have a mark, and the rest is individual mark. So you have to combine, you have to work together like that. Okay, Rawan, did I answer your question?
Yes, Doctor.
Okay. But who will present first, second, third, fifth? You can decide. For me, no problem. I won't tell you. You present first. But I expect that you understand the whole presentation. Not if your part is cardiovascular, only you study the cardiovascular. You have to study everything, but you want to present cardiovascular. Akil, who's with you? Okay, any other question? No, okay, so stop sharing. Okay, we will end the meeting, okay? Thank you so much, bye.
Thank you, Doctor.
Okay, I didn't involve everybody, so maybe next time, okay? Okay, bye, enjoy your day, bye-bye.